Hello everyone, this is Xing from Hong Kong Baptist University. Today I'm going to introduce our research work, Diagnose with Uncertainty Awareness, Diagnostic Uncertainty Encoding Framework for Radiology Report Generation. Radiology X-ray report generation is a task that uses the machine to automatically generate the radiology report. As we know, interpreting chest X-ray as radiology report by clinicians is a demanding task. Writing report is laborious and time-consuming, while an automatic reporting system could alleviate this burden. Diagnose usually associated with some uncertainty. For example, a small left pleural effusion could be present. This is a kind of uncertain diagnosis. The uncertain diagnosis of the radiology images diagnosis is very common. Here is a statistic of the radiology abnormalities presented by a large-scale radiologist report dataset mimic CXR. As we can see, for some abnormalities, there are more than a half of the diagnosis are uncertain. So in this work, we are going to learn the diagnostic uncertainty. We explore abnormalities, varieties, and observe variabilities of the diagnostic uncertainty in radiology images. And then we estimate the variabilities by the diagnostic belief of abnormalities' existence in the radiology diagnosis. We then encode the diagnostic uncertainty into a deep learning model for uncertainty-aware radiology report generation. For the variabilities in the diagnostic uncertainty, in this work, we mainly consider two kinds of the variabilities. The first is abnormality variability, also known as class variance. We consider the intra-abnormalities variabilities, where samples of the same abnormalities could be dissimilar. And also, we consider the inter-abnormalities variabilities, where samples of different abnormalities could be similar. Another kind of variabilities we consider is the observer variabilities, also known as radiologist disagreement. As referred to a related work, when using imaging tests compared to other types of tests, for example, the laboratory-based tests, there is additional variabilities caused by different observer interpreting the images. In this work, we consider intra-observer variabilities of test results when one observer performed the same test on the same patients in different conditions, before or after reading clinical notes of that patients, for example. For the intra-abnormality variabilities, we consider that when abnormalities has variant appearance and the predictions toward the detecting observations is hard to confirm. So we are going to learn a range of uncertain diagnoses. If the diagnostic belief found inside, an uncertain diagnosis could be concluded. Otherwise, if the diagnostic belief beyond the range, then a certain diagnosis could be confirmed. The next, we consider the inter-abnormalities variabilities, when one abnormal observations could be related to conflict abnormalities with similar appearance, such that diagnostic belief of each abnormality is close to an average level. Then a certain abnormalities could not be discriminated from others, if so. And if the diagnostic belief of one abnormality is beyond the average level, then the existence of that abnormalities could be confirmed. We also consider the intra-observer variabilities, where varying predictions can be made by one observer, that is, the radiologist, from the same observations. In the implementations, we do a set of augmentation operations on the visuals embeddings. the corresponding diagnostic belief changes significantly, then the conferred diagnosis might not be concluded. Or if the diagnostic belief is stable, then a diagnosis could be conferred accordingly. So we propose our diagnostic uncertainty encoding framework, where the details of the technical and the model architectures could be found in our paper. Thank you for listening.